Good morning and welcome to UN City in Copenhagen. My name is Banu Bhatnagar. Thank you for joining us today for this press briefing. To members of the press who are joining us online, please ensure that the name, your name and your media outlet is visible on your Zoom profile. And when it comes to the Q&A section, please raise your hand and I'll come to you in due course so you can ask your question of the panelists. So, as I said, we're holding our sort of summer press briefing today before handing over to the Regional Director, Dr. Hans Kluge, to make his opening statement on the various health concerns facing our region. Let me also introduce Dr. Catherine Smallwood, our Senior Emergency Officer here at WHO Europe, who is also ready to take your questions. And we also have Dr. Gerald Rock, Senior Regional Emergency Director here at WHO Europe, who is also available to take your questions. So without further delay, Regional Director, Dr. Kluge, you have the floor.
Good morning. This summer will be the first in more than 3 years that many of us will enjoy without the looming threat of COVID-19. Whilst it may not be a global public health emergency, however, COVID-19 has not gone away. Close to 1,000 new COVID-19 deaths continue to occur across the region every week. And this is an underestimate due to a drop in countries regularly reporting COVID-19 deaths to WHO. And it continues to disproportionately affect the weakest and the most vulnerable. COVID-19 exploited an epidemic of diseases, including cancers, cardiovascular disease, diabetes, and chronic lung illnesses, which account for 75% of mortality in our region today. Those with such underlying conditions were, and still are, far more vulnerable to severe forms of COVID-19. Yet simple solutions can help reduce the burden of the so-called non-communicable diseases and fight the next pandemic when it arrives. Those of us with the means and opportunity can, for example, undertake 25 minutes of moderate exercise a day, quit smoking, the less alcohol the better, and limit salt intake. Long COVID remains a complex condition we still know very little about. According to estimates from our collaborating center, the Institute for Health Metrics and Evaluation at University of Washington in Seattle, nearly 36 million people across the WHO European region may have experienced long COVID in the first 3 years of the pandemic. That's approximately 1 in 30 Europeans over the past 3 years. That's 1 in 30 who may still be finding it hard to return to normal life. 1 in 30 who could be suffering in silence, left behind as others move on from COVID-19. We are listening to the calls from long COVID patients and support groups and raising awareness of their plight, but clearly much more needs to be done to understand it. Long COVID remains a glaring blind spot in our knowledge that urgently needs to be filled. Unless we develop comprehensive diagnostics and treatment for long COVID, we will never truly recover from the pandemic. We are encouraging more research is undertaking and urging those eligible for COVID-19 vaccination to be vaccinated. This under-recognized condition should be taken seriously across the health and social sectors, and we should assure ample care is available for patients. Ultimately, the best way to avoid long COVID is to avoid COVID-19 in the first place. So the priority must be to vaccinate vulnerable populations, the elderly, people with underlying medical conditions, and the immunocompromised. We should ensure at least 70% vaccine coverage for these groups, including both primary and additional booster doses. A few words about the unusually warm summer we are experiencing. A new report from the European Union and the World Meteorological Organization recently warned that Europe has been warming twice as fast as the global average since the 1980s. And extreme heat in the summer months is becoming the norm, not the exception. Last year in our region, extreme heat claimed 20,000 lives between June and August. Last week, Spain and Portugal recorded temperatures in excess of 40 degrees, greatly increasing the risk of wildfires. Earlier this month, Kazakhstan saw deadly wildfires claim the lives of at least 15 people, 14 of whom were firefighters. At the same time, other parts of our region saw flash flooding and landslides, which also claimed lives. So look out for each other during the summer months by checking in on your elderly relatives and neighbors, limiting outdoor activity when it's very warm, staying hydrated, keeping your homes cool and allowing yourself time to rest. Alongside an increased recent risk of extreme heat, I would also like to draw your attention to a recent resurgence of Mpox infections, first in the United States and then in the UK, Spain, Belgium and the Netherlands. The European region recorded 22 new Mpox cases during the month of May. While this might seem low, it tells us the virus continues to circulate in Europe, particularly affecting men who have sex with men, and we could see a resurgence. For those of you who know you are at high risk, there are things you can do. Get vaccinated against Mpox if vaccines are available and you are eligible. Limit contact with others if you have symptoms. And avoid close physical contact, including sexual contact with someone who has Mpox. At WHO, we continue urging countries to reach everyone at risk, to eliminate discrimination and Mpox from the community. I welcome the United Kingdom's recent decision to continue its vaccination program and urge other countries to continue to reduce barriers to testing, vaccination and care for persons belonging to groups at continued risk. In summary, all three of these health emergencies, COVID-19, Mpox and extreme heat, call for a change in our collective approaches, in our allocation of resources, and also in our individual behaviors. Thank you.
Thank you very much, Regional Director, for those opening remarks. And with that, we can open the floor. As I mentioned, if you'd like to ask a question, please raise your hand. We've also received a few questions in advance, so I will go to some of them while we wait for some of the journalists to ask their questions. So if I may, Dr. Smallwood, actually come to you, because we have just recently launched a COVID-19 transition plan as, of course, COVID-19 is no longer a global public health emergency, as announced in May. So could you tell us a little bit about the transition plan and why is it so important now?
Yeah, thanks a lot, Banu. So that's quite right. We've just released this transition plan, which is in line with the global plan that covers several years ahead as we come out of the emergency phase of the pandemic. There are some basic messages for individuals as we go about our lives as usual, returning to life as normal. The messages are really stay vigilant, know your risk. If you're offered a vaccine, please go ahead and seek it out. Some of these measures are very, very clear. But for member states, governments, public health authorities, the real message here is this is not the time to pack up and move away from COVID-19. Right now, we have a huge opportunity to invest in and sustain the gains made over the past 3 years. We have learned a tremendous amount. We need to right-size those COVID response operations into day-to-day public health operations, public health services. We need to learn from them, we need to invest in them, and we need to keep addressing the long-term sequelae of COVID, such as long COVID, and some of the potential downstream impacts of repeated infections. These continue to have a profound impact on health across the world, and they cannot be left behind.
Thank you very much, Dr. Smallwood. I see Lauren Chadwick from Euronews has her hand up. Hi, Lauren. Good to see your hand. Please do unmute yourself and ask your question. We can't hear you. No, I'm afraid we're not getting audio, I'm afraid. Lauren, would you mind maybe typing your question into the chat? And in the meantime, I will move on, and we'll take your question once you've written that down. Today marks also 3 weeks to the day since the destruction of the Kakhovka Dam in Ukraine and the resulting floods downstream, which have had immense health implications for populations on both sides of the contact line. If I may go to the regional director, but then also to Dr. Gerald Rock, our regional emergency director, what are some of the biggest health concerns that we are seeing at the moment?
A week and a half ago, I was with the Minister of Health of Ukraine, Dr. Viktor Lashko, in Poznan at a meeting organized by the Minister of Health of Poland, Adam Niedzilski, on the health system recovery. And Minister Lashko was telling that up to 1 million people are now really challenged in terms of lack of safe, clean water, which is tremendous. We're working together to beef up the surveillance, particularly for what we call waterborne diseases, which includes diseases as cholera, but also typhoid, hepatitis, etc. But besides of that one, due to the massive destruction, there is also lack of access to basic health services, like, for example, routine immunization. And then remains the big issue for which we have been calling for more than a year now on all parties for an international humanitarian corridor, of lack of access to the people in areas as Mariupol and Donbass, where still WHO does not have access, and we're very concerned that people are being left behind.
Thank you, Regional Director. Dr. Rakashaba, would you like to add anything on the health impacts of the floods? Oh dear, not hearing anything. Sorry, Dr. Rakashaba, we're not hearing audio. Nope. Maybe. Okay. Yep, we're trying to fix the audio, Gerald. Just give us a minute, so we'll let you know if that's fixed. So I've got the question here from Lauren Chadwick from Euronews. She's saying, I was wondering, as we discussed the transition from the health emergency phase of the COVID-19 pandemic, we saw that many health workers experienced burnout and pressure on health systems. Is this an area where we see some recovery, where governments are investing more in health and taking the risk of burnout among health workers more seriously? Yeah.
Yes, maybe I will kickstart, then we can go to Dr. Smallwood. Absolutely. This is a number one topic that is coming back in my conversations, be it with presidents, heads of government, minister of health, healthcare workers. I would situate it in our broader flagship initiative of mental health. All countries and WHO Office for Europe are doubling the efforts in the field of mental health. I mean, this has been a great exhaustion of 3 years of COVID-19 and still a ongoing devastating war in Ukraine. One of the main points coming out of the research on the mental health that we are doing with collaborating centers and institutions is that everyone is vulnerable. So it's not that we can identify a particular group which is more vulnerable to burnout or mental health issues. Everyone is potentially vulnerable to mental health. It's very important to take these issues out of the dark corner, to talk about it, that every large institution has a focal point that people know to who to talk to, As an example, in the WHO Regional Office for Europe, where we also have a considerable amount of proportion of burnout, there are team meetings because it depends on the context. Each team to have discussions, identify the barriers, and then go to the management to put in place the enabling conditions. And that's very important, that the responsibility is not being put solely on the individual. The management has a lot of actions to take, but it has to be from both sides. I was having a discussion yesterday regularly with Director General of the Danish Health Authority, Dr. Søren Brøstrøm, who was telling that he sees a considerable improvement, but only after calling in specialized HR support. So it's not something that is going to be solved just on its own. It really requires a massive investment and attention.
Thank you. Dr. Smallwood, would you like to add anything?
Yes, I'd just like to add that workforce is one of the 13 strategic shifts that we've highlighted in the transition plan, bearing in mind the immense toll that COVID-19 took on an already stretched health workforce. And here we're not only referring to the doctors, the nurses, people working, staffing our health facilities, but we're also talking about the people doing the epidemiologic investigations, the laboratory testing. All of these elements of the workforce have suffered over the past 3 years and need to recover better, stronger. And that's the point of this transition plan. Secondly, in terms of recovery and in the disruptions that we saw during the pandemic, in Q4 of last year, we saw the early signs of recovery, and we've seen those signs also here in the European region. However, 1 in 5 countries in the European region still report significant disruptions in most healthcare settings. And so there's a lot of work still to be done. Whilst on the day-to-day level, we tend to think COVID-19 has kind of moved on and we're out of it, in the health facilities, in our health systems, it's very much present. It's very much impacting our day-to-day work still, and there's still a lot of work to be done. So this is why this call to action through the transition plan.
Thank you, Dr. Smallwood. And just to alert everyone, we're still having some audio issues on Zoom. So I've seen a couple of journalists have written their questions in the chat. So please continue to do that for the time being. We have a question from Hugo Greenhall at Openly Thomson Reuters Foundation. 2 questions around Mpox. We're in the thick of Pride Month at the moment, with marches and parades around the world. In the context of Mpox, what would your advice be for people thinking about attending a Pride March? And 2, you mentioned that what people exposed to Mpox should be doing, but should gay men in particular modify their behavior? For example, avoiding sex clubs and saunas until the issue of Mpox has passed. I can give that over to Dr. Smallwood.
The Mpox outbreak has not passed, as the regional director said. We're still picking up cases. That means that the virus is lurking among communities, and it's spreading within the same community it entered in the European region, which is particular men who have sex with men, in particular social networks. And so as we enter this period of the Pride celebrations, the travel across the region, we need to remain extremely vigilant at that population level to catch early any signs of disease. And that includes working in sex on premises businesses. And we've had extremely good collaborations and partnerships with people managing these types of venues to raise awareness, to provide information, and to link up those particular businesses with healthcare providers, people providing testing, people providing vaccination, so that we can really reduce the barriers that are still there, and prevent people, for various reasons, from accessing either testing or vaccination. But the bottom line is, if people are at higher risk, and these people will know which groups these are men who have sex with men, who have frequent sexual encounters with many different individuals, you're at an increased risk, and we really encourage people to seek out vaccination if it's available to you.
Thank you. A follow-up question from Lauren Chadwick, also on Mpox. She's asking whether this recent resurgence, small though it may be, is surprising. And what does WHO Europe recommend policymakers do about the resurgence? So we were talking about individual behavior on one side, but what is the policy response? Dr. Smallwood.
That's a great question. And from our perspective, the clear policy response is continued investment in an elimination strategy in the European region. We have the benefit here in Europe of not having an animal host, an animal reservoir of the virus. And so elimination, that means the stopping of sustained human-to-human transmission is quite possible. And that's what we implore member states, countries in the region to look into doing. In terms of, I think the question reminded me of the first part of the question.
So whether the resurgence was surprising to see?
In terms of whether the resurgence was a surprise, another great question, and the answer is no. We learned a lot from the outbreak in 2022, which had, of course, its peak just in the middle of the summer, where we saw thousands of cases being reported every day across several countries in Western Europe particularly. And we took a lot of time to look at why that was happening, look at the factors that determined not only the rise in infections, but also the decline. And we understood that certainly it was linked to increased travel, particularly in the phase of the June months where there was a lot of travel to Pride events for the first time during the pandemic. Remember, last year was the year where people really resumed travel. And this certainly helped drive some of the spread of the virus. And as that has happened, that same travel has happened early this spring and summer, we saw a risk of resurgence. But what's different this year is that the knowledge about the virus, how it spreads and how we can stop it is much more present. And in addition to that, we have countries that have undertaken really effective immunization and vaccination campaigns. So we always expected a resurgence. We expected it to be much lower than last year, but there's still a lot to do to get to elimination.
Thank you very much. And I'm told that our audio situation is resolved. So I would actually like to go back to Gerald, if we can hear him. Gerald, do you want to just unmute and...
Yes.
There we go. Yes, that we can hear you now. So if we can just sort of backtrack slightly, and I'm sorry for that slight technical glitch, but as we were discussing with you, it's been 3 weeks since the dam was destroyed, and the regional director laid out a few points, but would you like to elaborate on some of the sort of health impacts and also the response going forward to the floods?
Yeah, no, thanks very much, Banu. Obviously, the access to drinking water is the major health risk there, and that means an increased risk for infectious diseases, all kinds of communicable diseases due to the contamination of drinking water are a major public health risk there. But also, I think I would like to point to the mental health implications, to the access restrictions to health services, which are an issue. Now, we as WHO were in the lucky situation that we had already pre-positioned supplies, testing kits, etc., which we could mobilize to provide to local authorities. So I think we are, together with the enhanced surveillance that the authorities have put in place, in a good and robust position to pick up any outbreaks and to respond accordingly if the need would be. We also have been part of interagency convoys delivering essential health supplies and medicines to the area to strengthen the local health system to be able to cope with the massive consequences of this incident.
Thank you very much, Dr. Rakashaba. I'd like to take another question we received previously, and I'm going to go to the regional director for this. We've had a few journalists ask us, actually, multiple journalists, about the frequency and intensity of extreme weather events and extreme heat in the European region, indeed in the world. So what is the likelihood of these extreme events happening going forward? Any thoughts on that, Regional Director?
Well, as I mentioned, Europe has been warming twice as fast than the global average since the 1980s. And we are taking climate-related health emergencies very seriously. Next week, from 5 to 7 July, Hungary will host the WHO 5-yearly ministerial conference on health and environment, where there will be a lot of attention to come out with a declaration on what needs to be done at all levels of society and government related to the climate change and health. As of today, there are about more than 40 member states who have registered both sector of health and the sector of environment, and it will be preceded the 4th of July by a youth event.
Thank you very much, Regional Director. So I don't see any further questions online, and we've covered the topics that we came to speak to you about today. So I'd like to just give the floor one last time to the Regional Director for some closing remarks. Regional Director.
Maybe the point to mention, Banu, even if it's a bit early, is that 20 September in Bern in Switzerland, the WHO Regional Office for Europe will host the first indoor air quality conference together with Professor Antoine Flahaut from the Institute of Global Health, Geneva, Switzerland, because this is one of the big lessons learned from the pandemic that we should not forget and actually take forward the importance of clean air, be it for virus prevention and control or general health and well-being. Thank you.
Thank you very much, Regional Director. And on that note, I'd like to close today's press briefing. Thank you, Regional Director, and Dr. Smallwood as well for joining us. Thank you to members of the press, and apologies for the technical glitch on Zoom. These things happen. If you have any follow-up questions or require any follow-up material, please email our press office at eupress@who.int. And as ever, have a wonderful summer. Stay happy and healthy, and stay safe. Goodbye.